Good morning. Welcome to the workshop, Managing Fatigue After Transplant. My name is Gina Londino, and I am the Patient Access Manager for the New Jersey chapter of the Leukemia and Lymphoma Society. I will be your moderator this afternoon, and I am looking forward to hearing from our guest speaker about the important topic of managing fatigue. This session is designed to be interactive. We ask that you hold your questions until Dr. Steinberg has finished presenting. We are audio recording each session for those that cannot attend the meeting. When you ask your question, please make sure you speak into the microphone. Please join me in welcoming Dr. Amir Steinberg. Dr. Steinberg is an assistant professor in the Division of Hematology Oncology at Mount Sinai Hospital, where his work focuses on hematologic malignancies and stem cell transplantation. As a lymphoma survivor himself, he has a strong interest in cancer survivorship issues.
Hello. Thank you, Gina, and I also want to thank Jamie and Eileen for your assistance back there, as well as BMTInfoNet in general, and Susan Stewart and Marlo O'Keefe for having me. It's quite an honor, and I appreciate everyone for coming today. So the topic of my discussion is going to be on fatigue in stem cell transplant patients. I gave this talk earlier in the morning at 8:30. And we were just joking around that, I was surprised, that people came. It was exhausting, at 8:30 in the morning, certainly, or the earlier in the morning. And I didn't even think about it, but one of my colleagues who was giving another talk happened to bring that up, that it was kind of ironic that the fatigue talk was so early. So I want to, go down these topics. Fatigue, what is it? How common is it? How long does it last? What causes it? The impact it has, how to deal with fatigue, and methods for alleviating fatigue. So we'll touch on all these topics, and I'll go over, just pretty much sequentially. So in general, the fatigue has been described various ways. Clinical research emphasizes the individual perception of fatigue or tiredness. And then there's also, researchers might try to gauge things, based on observation. But really, a lot of our definitions of fatigue come from how the patients are feeling. Muscle physiologists view fatigue as performance decrement, observed via reduced muscle strength or increased error rates on tasks requiring vigilance. Now, this organization called Assessing Symptoms of Cancer Using Patient-Reported Outcomes, that's what patients think based on, surveys or scales that they fill out. They put together a task force that reviewed the definitions of cancer-related fatigue, and they noted over 30 definitions in the medical literature at the time that they put together the task force. And they came out with their own based on all those definitions. And the perception of unusual tiredness that varies in pattern or severity and has a negative impact on the ability to function in people who have or have had cancer. And then one more definition from the National Comprehensive Cancer Network, NCCN. It's a group of organizations in this country. I would say maybe there is 20 or so organizations of just very large cancer centers, and they have transplant facilities as well there. They got together and they came out with the definition of cancer-related fatigue: a distressing, persistent, subjective sense of physical, emotional, and or cognitive tiredness or exhaustion related to cancer or cancer treatment that is not proportional to recent activity. And it's the most commonly reported side effect of cancer treatment. So we're going to focus today on fatigue related to transplant, but I thought it was important to lay the groundwork for cancer-related fatigue, because that's basically what it's part of, in essence. So patients with cancer-related fatigue, they often feel tired even after resting, and they have reduced capacity to carry out normal activities. So that's the key, is affecting function. That's what I think separates cancer-related fatigue or post-transplant-related fatigue from just any old fatigue of doing a marathon, let's say, is It's going to affect your function, your ability to work or interact with people or go shopping. And you can experience a slower recovery of physical activity after tasks. And you can report diminished concentration as well as cognitive deficits. So fatigue can affect your mind, and it's also your mind can affect fatigue. And we'll get into that. So how common is it in transplant patients? You're going to see here a wide range of incidents. 23% to 76% of survivors have experienced post-transplant fatigue. And that's pretty wide. Why is that? Why do some studies show 23% or a quarter of patients and others showing 3/4 of patients? And so the reasons are the study's definition of fatigue. What did the researchers consider fatigue, or the scale? When they hand out something to patients to fill out, it has different scales on what's considered fatigue. The patient's definition of fatigue, I think that's the biggest one. And we saw that in our last talk, earlier on today when I gave this talk. A lot of the patients asked questions afterwards, and everybody had different descriptions of what their fatigue was like. Also just the scale used, and also the period of time after transplant, and as you're going to see. It can vary. Here, just in one study of 172 adult transplant patients, they were on average 3.5 years out from transplant. 65% had reported problems with energy, and 66, 2/3, considered their current energy level to be worse than prior to the cancer diagnosis. Yeah, so it's exhaustive hearing about how severe these symptoms are. Really, as I was preparing this talk, it was kind of, it's frustrating to hear, that all these patients, people in this room, they're suffering from fatigue. And it didn't matter, who was suffering from fatigue. It didn't matter. You could be male, female. There was no difference between them. Age, less than 40, over 40, radiation or no radiation. So not being able to pinpoint the cause was certainly disconcerting. Whether you had an autologous transplant or an allo transplant, you would think that with an allo transplant maybe you have more fatigue. That wasn't the case in this study. Time from transplant, whether it's like a year out, a few years out, you still there wasn't really much difference with who was experiencing the fatigue. Education level, diagnosis, didn't matter. Leukemia, lymphoma, myeloma, MDS. So how long does the fatigue last? It turns out it's basically the most persistent symptom beyond the first year of recovery. So it lasts a long time, potentially. In this study here, you could see I circled the percentage of patients who had severe fatigue, the percentage of survivors who had severe fatigue after transplant. Between 1 and 5 years after transplant, 41% experienced severe fatigue. That was based on the scale that they were using. And then going on down, even 15 years out, 35% of patients were still experiencing severe fatigue. So it's not unusual. So if you're having fatigue 15 years out, don't think what's wrong with me. Everybody's got it. You should think what's wrong with you and how to figure it out, but don't think you're unusual in that respect. All right, this is a study I thought I would just present from Dr. Bhatia from City of Hope. She provided the slide for me. What you can see here is just to emphasize that in her particular study, again, they used a different scale, a different definition on fatigue. But you can see around years 2 and 3, the fatigue started to more sharply decline. You can see kind of that curve start to go down more quickly. So at least in her study, after 2 years, people started to have an improvement in their fatigue. So how burdensome is fatigue for those who have it? Well, you can patients who experience severe fatigue, they have more difficulty in coping with the experiences of cancer. They have more fear of disease recurrence, interestingly. Sleep disturbances, and we'll touch on that. And there was a talk, I believe, yesterday on sleep disturbance, which I picked up the PowerPoint. It was quite interesting. So maybe pick up a copy afterwards and had some good points. Physical activity. I attended Dr. Wood's talk just earlier in this room. where he talked about exercise, and he's actually going to be speaking after me here. So I thought that was a very educational talk. So maybe try and attend that one if you have a chance. As low social functioning, and all measurements correlated significantly with the severity of the patient's fatigue. Then it kind of brings up the question of the chicken or the egg. Because fatigue could potentially cause sleep disturbances, but sleep disturbances, as we'll see, can affect fatigue, can cause fatigue. Same with physical activity. If you're not exercising as much, that might cause more fatigue, and yet if you're fatigued, you don't feel like exercising. So it could be quite frustrating once again. So what causes fatigue? There are multiple factors involved with bone marrow transplant fatigue. And someone asked at the previous talk a question like, what could be causing my husband's fatigue? And I kind of went through with her kind of in a stepwise manner, certainly not knowing all the details. And one of the things we first focus on, as you'll see with the upcoming table, is prior therapies, current medications. Does the transplant patient still have the disease? Because if you've still got the condition, it may be causing anemia in you, and that might be causing your fatigue. Infections, if you have an active infection, or if you're on medications for the infection, that could certainly affect your energy level. The anemia, and psychosocial reasons. So these are the things we kind of can focus on first, that we try to fix the best we can. And oftentimes we try fixing it certainly with medications. And here I just kind of circled that. And you'll see another table kind of focusing more on this. This is just from an article on cancer-related fatigue. But we focus first, you'll see, on the underlying disease. That could be the potential and most likely explanation for the fatigue, if they still have the disease. The various treatments, sometimes they could be undergoing treatments that could be causing anemia, or just can cause the fatigue even without causing anemia, the medications. Infections can cause it. Electrolyte disturbance, we got to look at their sodium, phosphorus, calcium, potassium. If you have disturbances in that can sometimes cause fatigue. We might ask them about their sleep. Medications, if you're on too many medications, possible polypharmacy means just potentially all the medications you're on causing. So we try and pinpoint a cause based on at least things we can measure and things that we have in front of us. So that's what a clinician would do first. And then psychologically, we might ask how you're feeling, because there is a connection between how you're feeling, your cognition, your psychological well-being, and your energy level. And again, this is just in more detail, just to kind of emphasize this, these are the various different things we might do. The anemia, we'll look for a cause if you have it and try and rectify it. We may offer medications for depression. Sleep, we may go into more details about that, and I'll touch about that shortly. Is something that you can do that can make a difference. And other conditions, the electrolyte abnormalities, sodium, potassium, or checking the thyroid. That's something that can affect transplant patients. It's recommended they have their thyroid checked annually starting 1 year after transplant, and that's something to keep an eye on. So, what can be done about fatigue? Just to emphasize, a lot of antidepressants. We look at your medications. Sometimes we can give medications that can increase alertness. There's a medication, for example, called modafinil that is kind of similar to Ritalin, which is given for attention deficit disorder. Modafinil can kind of increase your alertness. There was a study that looked at Decadron steroids, a short course of steroids that could improve people's energy, that was found to improve cancer patients' fatigue. So sometimes we can offer medications specifically for the fatigue that doesn't treat the underlying etiology, underlying cause. Correcting the anemia, medications for sleep. So these are things that we're going to be doing for you. Complementary medicine. There was a talk, I believe, earlier today, and I don't know if it's going to be repeated, just on complementary medicine. We're talking about acupuncture, for example. And there have been a couple studies showing that acupuncture may potentially be helpful for fatigue, anxiety, depression. And, so just to be honest, I was never, in medical school, you don't necessarily learn about all this, and only afterwards. So you kind of come into this idea with complementary medicine a little bit skeptical, but when you have studies, actual studies showing their benefits, that seeing is believing, and so I think that as more and more research shows, maybe complementary medicine can play more and more of a role in treating fatigue. So I want to keep that in mind for everybody. We have to start thinking outside the box for some of these conditions that we encounter. And there's less evidence for other complementary therapies, although they're looking at things like yoga. There's been potentially some evidence for that. That's still ongoing. So the question is, what can you do about the fatigue? We talked about, let's say, what your doctor may do, and as this woman was asking about her husband, what do you think it could be? I said, well, first we'll start with that whole big table that I brought up, medications, anemia, thyroid. Now, short of that, what can a patient do to feel like they can improve their fatigue? So I circled that again, just non-pharmacologic, non-medication treatments. We love to give pills, but there's other things we can do. Patient education. You're here in this room. You're learning about fatigue. You can read on your own about it. Exercise, and we'll talk about that. And again, you could stay for Dr. Wood's talk as well and learn more about what kind of exercise. Also, just stress management, cognitive therapies. And there was a talk yesterday about decreasing stress. And that certainly plays a role. Mindfulness, and we'll get into that. And then, of course, just eating right. So, cytokines, and will lead into kind of the first intervention I want to focus on. Cytokines are proteins in the body, and they regulate the body's response to infection, inflammation, injury. And we're starting to learn more and more about cytokines, how it can affect not only a person's ability to develop cancer, but to have a cancer recurrence, and also just fatigue as well. And you can see that cytokines, they are potentially stimulated by your immune system or by cancer cells, tumor cells. And the cytokines could then stimulate potential drug resistance to medications, psychobehavioral symptoms, anorexia, meaning not wanting to eat. And a lot of that can lead to fatigue. So I circled fatigue there. So cytokines play a key role in fatigue. As you can see here, in cancer-related fatigue, you can see that the cytokines, are thought to be one of the major reasons why people can get cancer-related fatigue, along with just the medication side effects, poor sleep. So how do we decrease the cytokines? How do we decrease the bad cytokines and increase the good cytokines? So anti-inflammatory cytokines may increase and pro-inflammatory cytokines may decrease due to exercise. So I'm not talking about that exercise that's going to happen like in the Giants game, like at 1 o'clock, let's say. Or even this heavy-duty exercise, a marathon runner. But more just kind of exercise that you can probably tolerate, an exercise that's manageable, just to start with after a transplant. This is, I'm going to just mention a couple of studies. One looked at 16 patients in one group, 16 patients in another group. The 16 patients in the first group, they went into a rehabilitation program for 6 weeks shortly after their transplant. The other 16 patients did not participate in the rehab program. And what kind of exercise did they do? So the training program consisted of walking on a treadmill, following an interval training pattern. The patients trained daily on weekdays for 6 weeks. So during the first week, they exercised about 5 sessions a day for 3 minutes each on the treadmill. Then, as with every week, they increased the duration of the interval, the duration that they exercised went up. So then they did 4 sessions of 5 minutes each. Then the next week, 3 sessions of 8 minutes. Then by the 4th week, 3 sessions of 10 minutes. 5th week, 2 sessions of 15, up to 30 minutes, up to the point where they could do basically a continuous 30-minute exercise on the treadmill. And when they were discharged from the hospital, the maximum physical performance and hemoglobin were similar in both groups. At 7 weeks, the group that had exercised had improved on maximal physical performance based on their scales and their measurements, and also, interestingly, improved hemoglobin. I thought that was quite fascinating. I wasn't sure the explanation was for that. And by the second exam, no patients in the training group had fatigue, but 4 in the control group did. So that just lends some credence to, maybe exercising could improve fatigue, at least in the short term after transplant. Here's another study, 25 transplant patients. And this was exercise within the hospital. They completed self-administered questionnaires, and they monitored the frequency and duration of their exercise during the hospital stay. And exercise generally consisted of cycling and walking. And the results of the analysis showed that exercise during hospitalization was significantly correlated with all quality of life indices, whether that's physical well-being, psychological well-being, depression, anxiety, and days hospitalized. Just to show you, just sometimes not so much fatigue, but sometimes too much exercise is bad, and sometimes too little is bad. You got to find a medium, the right area. And for example, risk of infection in this one study decreased the most when you were kind of found this middle balance here of exercise. So it's sometimes you got to listen to your body. That was I guess the main theme. Find the right exercise for you. Just keep in mind for bone disease precautions, particularly with multiple myeloma, that the increased risk of fracture, that you have always talk to a physician before you start such an exercise routine. Because you got to worry about the location of your bone lesions, the size of the lesions, and whether or not it's painful. The next thing I want to talk about, the other big thing, I guess, is sleep hygiene. That's just a picture of one of the oldest hematologists in the world, Dracula. So you have to, the main theme is to sleep and wake at regular times. You have to relax before bedtime. Don't just have a party and then expect to just go to bed and fall asleep right away. It's recommended that you create a dark, comfortable sleep environment. Avoid watching television or working in the bedroom. Get ample daylight during your non-sleep hours. Avoid naps. And I was just commenting in the earlier group, like when my kids take a nap at 4 p.m., I can forget about them going to sleep until like midnight or something. Avoid late naps. At the sleep talk yesterday, they suggested at the latest maybe a 3 p.m. nap if you're going to take one, because that's just going to make you not want to fall asleep later on in the evening. Limit caffeine and get regular exercise, but again, not within a few hours, not right before bedtime. Maybe do it kind of at 3 o'clock, at 7 at the latest. So yeah, between 4 and 7, it's like when they think it might be optimal to exercise. And as just like Dr. Wood had mentioned, 150 minutes of moderate exercise per week, that averages out to, let's say, maybe like 30 minutes a day. During the Monday through Friday. So I just again, listen to your body. I know it's sometimes hard finding the time or finding the energy to do it, but gradually, try and build your strength up to exercise more and more. And the exercise, it could be just even if it's just walking. I think it's terrific walking. Stick with it. The studies have shown that the longer one exercises, the better the benefits are. The next thing I want to talk about is not about Steve McQueen dying or fleeing Syria, but the mindful revolution. That's just it was a cover in Time magazine recently. Mindfulness, being aware of what your diagnosis is, being able to think about it and talk about it. It's helpful to talk about it, and they've done some studies that show it might help fatigue to be mindful of your diagnosis and your situation. So it's the practice of maintaining a non-judgmental state of heightened or complete awareness of one's thoughts, emotions, or experiences on a moment-to-moment basis. And you can be educated about mindfulness, and studies show that it has benefit in cancer fatigue. And sometimes cognitive behavioral therapy can be helpful in further analyzing this mindfulness. You can have a therapist who could see you to further analyze mindfulness within you. Or, sometimes they even have books, like at the bookstore, where you can learn about it. It's an active intervention, so sometimes there'll be homework for you to do, practice outside. You never thought you'd do homework again, right? But here you go. But seriously, they have workbooks at the bookstores that you could buy and do mindfulness exercises. And it can help for both sleep and fatigue. So relating to mindfulness, writing may be helpful. Writing about your condition, writing about what you're going through has been shown to be helpful. At least in other cancers, it may be helpful. We don't know, but in the future, it might be shown to be helpful actually in the transplant situation. So this particular study looked at 277 patients with kidney cancer, and they were randomly assigned to write about write on 4 separate occasions. They were split up into either a group that wrote about their diagnosis and their feelings about it, or just a group that wrote about neutral topics, okay? Split 50-50. And they completed these several questionnaires that measured fatigue and physical activity. Now, the patients who wrote about their cancer, they reported significantly better on certain symptom scores and higher physical ability scores at 10 months after intervention. So the conclusion was that writing about the cancer diagnosis might reduce cancer-related symptoms and improve physical functioning in patients with kidney cancer. This effect may occur through, the cognitive processing, the mindfulness. And is it helpful for transplant patients? We don't know, but I would feel it's worth a shot to try. Maybe it might be helpful. It's found in the kidney patients, might be helpful. I see little downside to it. Last thing I want to talk about is just bright white light therapy. So they have these light boxes. Maybe you've seen them at pharmacies, or you can get them on Amazon, and they emit bright white light. And during the light therapy, one's exposed to this device, and this device of bright white light has a higher level of lux, which is the international unit of light luminescence. Like inches measures length, weight is pounds, and then lux is the luminescence of the light. And recent research has shown that when given during chemo, bright white light, which is supposed to mimic the visible spectrum of sunlight, compared with dim red light, keeps cancer-related fatigue from getting worse. And so, building on that, investigators at my institution, Dr. William Redd at Mount Sinai, they tested this hypothesis that bright white light given after therapy completion would result in significant reduction in cancer-related fatigue when compared to dim red light in a population of 36 patients. Those 36 patients included post-transplant patients, post-chemo and radiation patients who had breast cancer, and post-gynecological cancer therapy. And the transplant patients, they ranged from 3 months to 3.5 years post-transplant. And one group of patients got the bright white light, and the other group of patients got the dim red light. But you couldn't tell the difference just by looking at that light box. They looked the same to the visible eye. So that's how they were able to compare them head to head. And in the beginning, the FACIT score, which measures fatigue, if it's less than 30, that's bad. You're fatigued. 100% of all the patients in each group in the bright white light with the blue column had that score, and also the dim red light. After the therapy, you could see that post-intervention, the bright white light group, bam, their fatigue significantly decreased. Whereas the dim red light group, they still had a significant proportion of patients with fatigue. And then just looking over time at baseline, you could see that the blue and the red are both underneath that dotted line, which kind of is the border with people who are really fatigued and those who are not. And you could see as time went by, 2 weeks, then 4 weeks, and 7 weeks, the dim red light group still had a significant fatigue, whereas the bright white light group got a lot better. And so, there's a trial open right now. You can go to clinicaltrials.gov and search it out, and if you want to contact Dr. Redd about participating. Just lastly, just other herbals that they're looking at. Ginseng, there's been some studies looking at that, helping fatigue. Yoga, as we alluded to, there's studies looking into that, as well as massage. It's since Egyptian times that's been looked at as a therapy, and there's more and more data potentially coming out of its benefits. So if you have any questions, I'd be happy to answer them. Thank you for listening.
question is about trying to wake up. The chemo gives me total exhaustion, and I was only like awake 2 hours a day. And then I started taking Nuvigil, which it's a drug for people with sleep apnea or who do shift work. And as long as you stay awake 45 minutes after you take it, I'm like, great for 12 hours. I have all my energy back. You do have to stay awake for a few minutes. Otherwise, I tried the exercise, 20 minutes, and I would be like collapsed. But I still have it that I can't wake up. And I take my chemo in the morning, not at night, so that it's like maybe worn off. But I think taking it every single day, it's just always there. But I have 3 alarms go off. I have the bright light go off. And I'm unconscious. And I have to have if I really have to get up, my neighbor calls me at one time. Then she'll call me a half hour later because I can even carry on a conversation and I'm still not up. And then she'll call me a second time. And if I don't call her back in 15 minutes, she comes over to drag me out of bed. But it's like I come to for a little bit, but it's gone then. And I'm back to like comatose.
Yeah. Certainly, it sounds very difficult what you're going through. And, I've had patients who, I guess you're not alone, although it sounds, I don't, like how can people relate to what you're going through? But it is real. I've seen other patients who have had your symptoms as well. And it is very difficult and frustrating trying to figure out something that will improve those symptoms. So I'm glad the medication you're receiving, which I think is similar to the modafinil that I brought up earlier in my talk, I'm glad that it's helping you somewhat. Certainly you don't want to just feel dependent on a medication. If exercise isn't working for you, you got to listen to your body. I think that's the main theme. And if the exercise is more harmful than beneficial for you, then, certainly we, hold off on that, or maybe start it again at much slower increments, just a little bit every day, and with time, perhaps it might be beneficial. And the other thing is, you may want to try, I don't know if you've tried, I guess, the cognitive therapies or mindfulness. Perhaps that might be beneficial for you, or something worth exploring. But certainly the big ones of exercise and sleep, in terms of improving fatigue, from what you're saying, those have been very difficult for you to use in terms of improving the fatigue. But sure. Thanks for sharing.
Hi, I was just wondering what your opinion was on using stimulants for fatigue, especially for people who are trying to go back to work or things like that.
Or going back to work, you said? Oh, okay. So I guess the medication that you were alluding to is a stimulant, I believe, and the modafinil with the medication I alluded to earlier as well. Again, ideally, if there is non-medication interventions that we could use, great. But if you need that, then if that's what helps you, then I think should be prescribed for you if you feel that's going to help you, certainly under the guidance and supervision of medical personnel. That said, there are other stimulants out there that might be beneficial. I had a tea before starting the second talk, because I got here very, very early, 6-something here, my transportation. So, I needed a little pick-me-up for this talk. So I think you can use a little bit caffeine in your system, just as we saw in the sleep hygiene PowerPoint, just don't do that too close to bedtime. But I think there are, natural stimulants that you can try as well.
Other questions?
Hi, to me, it seems like no matter how much sleep I get, I'm still tired. I wake up tired. I go to bed tired. If I do anything, I'm exhausted at the end of it. So, what should I do?
Oh, that's a great question. And when I do have patients who are having difficulties with their sleep, and let's say any medication that I might give them or sleep recommendations that I might give them in terms of behavioral changes they can make, if none of that's helping, I'll oftentimes, ask your doctor maybe to refer you to a sleep specialist if you haven't already seen one. They're either going to be psychiatrists or they're going to be pulmonologists. They do an extra 1 to 2 years of training specifically in sleep. And sometimes they'll send you to a sleep laboratory, and sometimes it may be actually a breathing issue that's causing you to be sleepy. You know, during the night, if you're not breathing well, if for whatever reason maybe you're not getting enough oxygen like flowing through your throat or your nose, sometimes a little bit of oxygen supplementing you during that time at night might be the intervention that you need, so that during the day you're feeling a lot stronger. Someone, for example, at the previous talk asked about sleep apnea. They had sleep apnea, and that's the therapy for sleep apnea is oxygen at night, and you feel a lot better during the day. So sleep specialists they can also monitor your sleep. Not necessarily if it's an oxygen related issue. They can, I believe, some of the interventions they do, they videotape you in a laboratory and see what kind of behavior you have and can make changes based on that.
Other questions? Okay, well, Dr. Steinberg, there were some questions submitted by people who unfortunately could not join us at the conference, so I'd be happy to read one off.
Oh, thank you.
Yes, so tremendous fatigue since transplant has led to being tremendously out of shape with very little motivation to improve. The fatigue is quite demoralizing as well. Can this last forever? It's been 10 years since my transplant. Thank you.
I can, I understand. I don't know if there's a way to communicate with a person who emailed, but certainly, like to the audience, you saw the statistics that even 15 years out, maybe a third of patients might experience quote-unquote severe fatigue. So I wish I could say that it's not going to last forever, and as time and time goes on, I hope that those symptoms improve. You saw in one of the graphs that, for example, between years 2 and 3, in the study from City of Hope, the fatigue started to appreciably get better. So I think there's hope to improve. I don't want to be a skeptical person that it's going to last forever, but I understand that somebody who's been undergoing that for 10 to 15 years, it's hard for them to hear that it might get better, certainly. But I would say, don't give up, and there may be interventions out there, again, that they can attempt, and we touched on some of those.
Thank you. We have another question. At what point during my post-transplant recovery will the fatigue lessen? It's 13 months after my transplant, and I continue to suffer from extreme fatigue.
Right, so for everybody it's different. You saw in that graph again, that between 25 and 35% of patients, I think even 41% in one of the graphs, will experience fatigue just a few years out from transplant to 15 years out. So it runs the whole gamut. That being said, we saw that things can improve, especially in that one study where things started to get better between years 2 and 3. But a lot depends certainly on what the cause is. Do a further, a thorough workup. Could it be the thyroid, anemia? If something that's easily correctable, then if it's easily correctable, then the symptoms should improve quickly. If it's something that's not easily correctable, then that could take time, and that would involve further methods. Again, the mindfulness. I don't want to poo-poo that idea that there's more and more research showing that it may be beneficial in addition to the exercise and sleep.
Thank you. Other questions?
I guess I'm interested from a patient point of view. Is there anything that staff can do when you're actually in the middle of the transplant or immediately post-transplant that encourages you to want to participate in walking or any kind of exercise? Is teaching patients about this have any impact on actually being able to participate in the exercise?
That's a great question, and I don't know specifically whether there have been any interventions or studies showing what can motivate somebody to want to exercise more or do other interventions more that could improve their fatigue. That's something that may be worth exploring. I think maybe, it's difficult to do within a group activity, let's say when you're an inpatient in the hospital, because you maybe have to be staying in your room and you can't interact with other people. But one of the things I've noticed, for example, today, I've been hearing from patients or survivors, they're saying, it was so wonderful to see somebody else who has my condition, and we were able to talk. And I think that's very helpful, is group therapy, or being able to meet other people going through what you're going through and share ideas. And just even, again, talking about it, I think, is helpful. So I think that's what's great about this meeting, and maybe, who knows, maybe you can develop relationships after this meeting with people to try and get better. I think that the group approach, it takes a village. I don't have any political leanings. But okay.
Other questions?
No, that was a joke. All right.
Okay, well, if there are no further questions, please join me in thanking Dr. Steinberg.
Okay, thanks a lot. Thank you, everyone, for having me.